Hello, and welcome to another episode of What the Health. I'm Janelle Thompson, your family nurse practitioner at the Student Health Clinic. So today, what we are going to talk about will first be the female condom. This is an example of the dispensers that you will see tactfully placed in the bathrooms. This contains the female condoms, and this will be in the Brock Student Center female bathroom. You'll also find in the top level of the Hess Center, and then in the locker room bathroom of the Hess Center. A female condom is going to enable you as a female to have a device with you that can prevent pregnancy and also prevent transmission of sexually transmitted infections. And it also empowers you to have protection with you and not necessarily relying on somebody else. I don't discourage a female also carrying a male condom. No problems with that either. But female condoms are made specifically for a female to have and can be used for vaginal sex or for anal sex. So let's go ahead and open up the package. So it has a little slit on the side so that you can just simply tear it open. And you would reach in and you'll see that the condom has two rings in it. One ring that's quite a bit larger than the other. They both are flexible. The smaller ring is on the inside and the larger ring is at the bottom. So this whole condom is lubricated. Now you could use additional lubrication with this, but it's very important that if you do use an additional lubrication, that it's not a oil-based or a petroleum-based lubricant, because that with condoms can degrade the material and it can cause them to break. So how do we instill this or put it into the vagina? So you can see that this top ring is very flexible. You can fold it like this, and you actually insert it similar to how you would put a tampon in. So, vagina, and you would fold this and you would push it into the vaginal opening, and then you would actually take two fingers and go inside and you would push the inner ring up further, and you'll see that this ring, and it's going to, here on my hand, pop towards the top. That ring will go up and it will actually fit quite snugly up against the cervix, and then this tubing all hangs out of the vagina or within the vagina, and this stays on the outside at the vaginal opening. So what happens when sexual intercourse, the act is completed? How do you remove this? So we don't want to have any breakage and we don't want to have any spillage of the contents that are here. So it's recommended that you take the outer ring, you twist it, and twisting it is sealing off the inner contents, the semen, sperm, ejaculation material. Twist that and then gently pull it out, and then you discard it. This is not meant to be flushed down a toilet at all. Just put it in the garbage can. So, thank you for joining me for today's episode of What the Health, demonstrating how to use a female condom. Remember, ladies, this is a great opportunity for you to have an additional protective barrier method with you. This is a great way to prevent sexually transmitted infections, help prevent pregnancy. Key points with it is we will have them located in the restroom over at the Brock Student Center, and we'll also have them in the upper level bathrooms of the Hess Center, entrance of the Student Health Clinic, and in the locker rooms. Next week, we'll talk about male condoms. Thanks for joining me.